It is a fun morning here at Kettering Health Hamilton. We are celebrating Thomas Halsey, our Employee of the Month. Congratulations.
Thank you.
So there was a unique story, and actually Carrie, who is lucky enough to join us, is going to tell us a little bit about the story, the interaction that you had with a patient and then also the family member.
So it was a busy day on IMC. Thomas came to me and said, I'm just going to go get a coffee, step off the floor for a minute. He came back to the floor and came immediately to my office. And his look on his face was just different than when he left the floor. And he told me about the experience he had in the lobby and how he'd met a patient's family and was just very impacted by that. And then next week, that patient was on our floor and he was caring for that patient's family. And they shared with me how much that meant to him that day in the lobby. And it definitely impacted Thomas and the family.
Well, Carrie, thank you for sharing that story. So this patient, the family member who's here, his wife was in the ICU, and their newborn child was in the NICU, and they had some trouble conceiving and had a couple of miscarriages before. And so how did you know something was going on when you were going down to get your coffee for your break with this young man?
Yeah, just his facial expressions. He was very teary-eyed, and you just tell something was wrong.
Sure.
So I asked him if there was anything I could do or, help him with, and then he started telling me about his situation. So, yeah.
Well, thank you for being so attuned to just those around you, even when you're on a break. But sometimes it's not the medicines we give or the therapies we do, but it's the way that we treat people. And you made an impact on not a patient, but a family member, and then about a week later on his wife, who was here on the floor here in IMC. So thank you for being just an ambassador of healing and of love to that family. That's really cool.
Yeah, thank you. Thank you. I would be curious to know how they're doing now.
Yeah.
And so, but yeah.
Well, Thomas, a couple of things about you. How long have you been a nurse?
Just since the spring.
Okay.
I'm a new nurse.
You're a new nurse.
This is my first nursing job, yes.
Now, your beard would indicate that you have a couple of years of experience.
Yeah. No, I had spent close to 30 years as a paramedic, so
Okay.
I figured, I'm at the time, when I graduated nursing school, I was 52.
Mm-hmm.
So I thought, I still have some productivity left, so, why not try something new? So I became a nurse.
So why'd you choose nursing?
As a paramedic, you have your patient for such a short period of time. You pick them up, you drop them off,
Yeah.
and a lot of times you don't. You don't know what happens to them, what the outcome is.
Mm-hmm.
At least with nursing, you have them for a longer period of time, and I felt like I could make more of a difference. So,
Well, you are making a difference here at the hospital. So why did you choose Kettering Health Hamilton? Why did you choose to come work here on IMC?
well, IMC won because it is a challenging floor. It's a very busy floor. I felt I would have the greatest opportunity to learn because I am kind of behind the curve here, or under the gun, so to speak, because of my age, and trying to get the most experience I can in the shortest amount of time. And this was a great floor. It is a great floor to get that experience. But why Kettering Health? As a paramedic, you're in and out a lot of different hospitals, and there's definitely was a difference in attitude between the employees. I don't want to mention exactly what hospital chain, but you could tell the people that liked their job and that didn't like their job. And I've never experienced anyone with the Kettering network that did not like their job. So,
well, it's definitely who you work with.
Yeah.
That's more important oftentimes than what you do.
yeah.
So annual evaluations are coming up. So Carrie, how's Thomas doing?
Oh, he's doing fabulous. This is not the first compliment we've heard on Thomas.
So it's not your first rodeo, and I would say that you're actually thriving, not just behind the gun or behind the eight ball, whatever metaphor you want to use. You're doing an amazing job here at the hospital.
Thank you.
So as we close out, what's one unique thing about you that maybe somebody out there wouldn't know?
Big sci-fi nerd.
Sci-fi nerd.
Yeah.
What sci-fi do you like?
Blade Runner, Star Wars, Star Trek, you name it.
Okay.
Pretty much on board.
Okay.
Marvel. Everyone argues Marvel versus DC. I'll take them both.
You'll take them both?
Yeah.
Spaceballs?
Yeah.
All right.
Yeah.
Well, there you have it. If you're looking for a buddy to watch some sci-fi movies, give Thomas a call. More importantly, if you see him in the hallways, give him a high five and congratulate him for being our Employee of the Month here at Kettering Health Hamilton. Congratulations.
Thank you. Appreciate it.